Right, so we'll discuss the anatomy of the urinary tract, which includes the kidney, the ureter, the bladder. Then we also have the urethra at the distal end there. Right. So right here, on this picture that I'm showing here, we can appreciate the two kidneys on either side here. They lie in the retroperitoneal position. And so the kidneys are actually retroperitoneal organs that are behind the peritoneum. They are not intraperitoneal in any nature. And if you want to classify the retroperitoneal nature of the kidney, they are primary retroperitoneal organs in the sense that they form initially outside the peritoneum. They will never form associated with the peritoneum. For example, the pancreas initially it starts intraperitoneal, then becomes secondarily retroperitoneal. The kidneys they form or they start off as being retroperitoneal, then they end as being retroperitoneal. Function-wise, the kidneys they have quite a number of functions. Some of the things that are overlooked, besides the urine thing that we all know, they regulate acid-base balance. I'm coming from a lesson that I was doing for chemical pathology of acid-base balance. So you find that kidneys, they help us with a regulation of acid-base balance. Some of the buffer systems that work in the body for acid-base balance, they actually exist within the kidney. So it helps us with pH maintenance of blood. And then, of course, there's the issue of removing waste products, electrolyte regulation and balances, and a whole lot of other things that the kidneys can do. But with respect to the gross anatomy, the kidneys are reddish brown. So you can see here, the kidneys are reddish brown organs that I have just said are on the posterior abdominal wall behind the peritoneum. And so they are retroperitoneal organs. And if you look at this picture here, you can see that they actually differ in terms of the upper pores, right? So the right kidney is slightly lower than the left. Why? Because of the larger right lobe of the liver. Remember when we were doing the liver, the right kidney was one of the organs that form an impression on the outside or on the visceral surface of the liver. So you'd find that the liver actually pushes the right kidney to a position that is lower down compared to the left kidney, right? Then there is the diaphragm higher up that separates the thorax above from the abdomen below, right? So if you are in inspiration, remember your thorax, the diaphragm is the chief inspiratory muscle. And though it's the chief inspiratory muscle, when it descends, right, during contraction, it's also going to push these kidneys down, right? Then this is a very nice diagram that shows us the coverings of the kidney. So just like any other organ that you have come across histologically, an organ will have a capsule on the outside. More likely, the capsule will be dense, irregular connective tissue to allow the organ to expand in any direction. Right. So for the kidney, we will also have a capsule. So kidney will also have a capsule that covers it. So here, this is kidney. So we have a fibrous capsule that follows it. Right. After the capsule, there's what we call perirenal fat. This one, labeled perinephric fat here, still the same thing. Right. So there's perirenal fat. Then there's renal fascia, this silver line here. This is what we call renal fascia. Right. This renal fascia continues on the lateral sides here with fascia transversalis. Remember the walls of the abdomen, skin, superficial fascia, which we divide into the fatty layer and the membranous layer, deep fascia, muscles, after the muscles, there was fascia transversalis. So this renal fascia is continuous with fascia transversalis. Then after this renal fascia, more on the outside, there is pararenal fat. This pararenal fat is part of the retroperitoneal fat that you mentioned when you're doing the walls of the abdomen. So what are the four coverings of the kidney? There is the fibrous renal capsule, there is the perirenal fat, there is the renal fascia, then there is the pararenal fat. Right. So what really supports or holds the kidney in position, the last three layers do. The perirenal fat, the renal fascia, and the pararenal fat, they hold the kidney in position on the posterior abdominal wall. Right. And as you can appreciate, your kidneys have this concave surface here. They have a concave and a convex end. The concave end is the hilum. So the hilum of the kidney is where where blood vessels and lymphatics enter and exit. Right? That's the hilum of the kidney. That's where things go in. That's where things go out. Right? So we have relations. So remember I said the 12th kidney is higher than not the 12th rather, the left kidney is higher than the right kidney. So in terms of rib associations, look at on the left here. This is the left kidney that is being shown here. The left kidney is related to rib number 12, rib number 11. But since the right kidney is a bit lower, it is only associated with rib number 12. So right kidney is at a lower position, hence only associated with rib number 12. Left kidney is at a higher position, hence only associated with, not only, but hence also associated with rib number 11 on top of rib number 12. Then these muscles that you see that are forming impressions on the kidney, remember I said the kidney is on the posterior abdominal wall. So the same muscles that you did on the posterior abdominal wall, which were the psoas major and the quadratus lumborum, will also form impressions. So these kidneys actually sit on those muscles, psoas major and quadratus lumborum. And they are also in contact with the diaphragm on the reddish brownish ends there. Right. Something that I left out before moving here, on top of each kidney, I think you can see here, there is something that is called a suprarenal gland. The suprarenal glands are what you guys favor to call adrenal glands in physiology. The ones that produce cortisol, your mineralocorticoids, and also your sex hormones. Right. So on top of each kidney, there is a suprarenal gland. Right. So you have a suprarenal gland on top of each kidney. Right. Then those are your kidneys associated with the ribs. They're on the posterior abdominal wall in the retroperitoneal position. Right. This is a more elaborate picture. Right. So there is those that like mnemonics. Growing up, we were taught this one. U, A. So remember, there is a renal vein, there's a renal artery, then there's the ureter. So when you go onto the hilum of the kidney, the order of structures from anterior going posterior, there is the renal vein, which you can see in blue here. Then there is the artery. This is why I've given two arteries. This renal artery will start to divide into what we call segmental arteries. There are about 5. So you see an artery first, then you see the ureter, then you have another branch of the artery at the back. Right? So the mnemonic is VAUA. So renal vein, renal artery, then the ureter. Right. Okay. So yeah. So that's your renal vein, that's your renal artery. Then here you have the ureter, right, which will be the next thing that we'll talk about after the kidney. Right. So a bit of microscopic anatomy for the kidney. The ureter enters at the hilum, right? And this is where we have the renal sinus, this dilatation. The renal sinus will lead into what we call major calyces. The major calyces will be about 2 or 3 in number. Then your major calyces will lead into minor calyces. Right. These that are almost triangular, these are what we call renal pyramids. So this is a renal pyramid. This structure here, these structures here, these are renal pyramids. Renal pyramids have an apex here. So let me draw. So renal pyramids have an apex here, where I've drawn. Right. The apex projects towards the hilum. Then there's a cortex, not a cortex, but there's a base here, which is towards the cortex side here, where I've put the X. That's the cortex. Right. Remember, kidney will have a cortex and a medulla. The renal pyramid, the base of the renal pyramid faces the cortex. Then the apex of the renal pyramid points towards the hilum. Right. I don't want to speak much about histology since there is a section for that. Then blood supply for the kidney. The kidneys get their blood supply from what we call the renal arteries. Renal arteries are branches of the aorta, specifically the abdominal aorta, as it is still in the abdomen before it enters, before it divides rather to give you common iliacs and goes to the pelvis, whatever. So renal arteries, they come off the abdominal aorta as lateral visceral branches. Remember, there are 3 lateral visceral branches, one for the kidney, one for the testis or ovary, then one for the suprarenal gland. So at the level of L2, lumbar vertebra, we get one of the renal arteries on either side. So there's a left renal, there's a right renal. These renal arteries divide into what we call segmental arteries. Then segmental arteries give you lobar. This I'll do again with histology. So segmental, then lobar. From lobar, we go to interlobar. From interlobar, we'll talk about arcuate. The arcuate arteries are at the base of the renal pyramids there. They form an arc there. Right. Then after arcuate, we start to think about interlobular. Then after interlobular, you go to the arterioles, where there's afferent, then efferent. I'm sure you do that with renal physiology, but just know that we have a renal artery coming off the abdominal aorta is a lateral visceral branch. The same applies to the veins. So we have renal veins that then exit the kidney. The renal veins empty into the inferior vena cava, both the left and the right. But before the right renal vein goes to the inferior vena cava, it receives blood from other organs. So before the right renal vein empties, it receives blood from the right testis. That's if it's a male. If it's a female, it's the right ovary. Then also the right suprarenal gland. They will also drain to the right renal vein before it goes to the inferior vena cava. Right. Then the rules still apply. When we're doing abdomen, we said, if you know blood supply, you know lymph drainage. So if the kidneys are getting their blood from the aorta via the renal arteries, that means the lymph from the kidneys will go to the lateral aortic nodes that are surrounding the aorta, because that's where the artery came from the lateral side of the artery. That's why I was saying lateral visceral branch. So if the arteries are coming from the lateral sides of the aorta, you expect the lymph to go to the lateral aortic nodes. Nerve innervation for the kidney rarely talked about, but just remember that we have sympathetic and parasympathetic, right? So it's a visceral organ, so we mention both parasympathetic and sympathetic, right? Imaging. So usually there is what we call a KUB, kidney ureter bladder, when you're doing urology. So you can have imaging for the urinary system to assess for obstruction or stones or whatever that may be happening within your 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 urinary system. So right, so this is your kidney. Those are the renal arteries coming off the aorta. Then you can see the renal veins going to the IVC. This is where the famous Titanic picture of I'm sure you've come across it. The famous Titanic picture of the girl and the guy. I think when they were running away from mom on the boat, when they are actually having that pause, it resembles the relationship of these renal vessels to each other with the aorta and the inferior vena cava, with the aorta and the IVC being the boy and the girl, then the renal vessels being their arms. And so I think just for interest sake, you can look at the picture, but it has nothing really to do with this. Okay. Then after the kidney, we have the ureters. So there's no really clear picture that shows us the ureter, but this here is doable. So these are your ureters. They're also on the posterior abdominal wall. They're also retroperitoneal. Something that I forgot to mention, the hilum of the kidney is at the transpyloric plane. Remember the transpyloric plane during abdomen anatomy, passing through L1. So hilum of your kidneys are at the transpyloric plane. I think this diagram clearly shows us that the left one is higher versus the right one. On top of them, you can see those brownish, light brownish organs, usually yellowish in the body. If you look at them, these are your suprarenal glands. Right. So these are the ureters, 25 centimeters in length. They remind us of the esophagus, which was also 25 centimeters. They remind us of the duodenum, 25 centimeters. They remind us of the descending colon, 25 centimeters as well. Right. The ureter has 3 constrictions, which reminds us of the esophagus, which also had 3 constrictions. Where are the 3 constrictions of the ureter? The first one is where it joins the renal pelvis in the kidney. The last one is where it joins the bladder. The middle one is where it crosses the pelvic brim. Right? And this ureter is a highly muscular organ because it has to allow for peristaltic movements of urine. Right? So peristaltic movements of urine are possible within the ureter so that urine can move. So we divide our ureter into thirds. So there's upper third, middle third, and lower third. Upper third gets its blood supply from the renal artery. It's closer to the kidney, so it gets its blood supply from the renal artery. Lower third is closer to the bladder, so it gets its blood supply from the artery of the bladder, which is superior vesicle. Then the middle third of the ureter gets its blood supply from if it's a male, testicular artery. If it's a female, ovarian artery. The veins are the same. Then lymph depends now. If it's upper third, it's going to follow the renal artery to the lateral aortic nodes. If it's middle third, the testicular or the ovarian, they also come from the aorta, so it's the same. However, internal superior vesical artery for the lower third comes from, if you want to be fancy, artery of it's the umbilical artery, a branch of internal iliac division, but let's just say internal iliac for now. So lymph from the lower third can go to internal iliac nodes, right? Though the bladder will not really follow the rule of where blood is coming from, lymph will also go, because you find that the bladder lymph can go to external iliac nodes, though there's no artery coming from external iliac artery, right? Then what else should I mention about the ureter? Okay. Then on top of the ureters, not on top of the ureters, but on top of the kidneys, we have suprarenal glands. So there's a mnemonic that I always give, which is rest in peace. So rest in peace. It means the right suprarenal gland is pyramidal in shape. Then the other one is LIC. I don't know what you used to remember LIC. The left suprarenal gland is crescentic in shape. It's like a quarter moon, right? Okay. So right is pyramidal, left is crescentic. What are the functions of the suprarenal glands? They help with endocrine function. They help with sex not really differentiation, but hormones for sexual maturation. So we divide the suprarenals into a cortex and the medulla. The medulla produces catecholamines, norepinephrine, epinephrine, and dopamine. Then the cortex we further divide into zona glomerulosa for mineralocorticoids like aldosterone, the main one. Then zona fasciculata for the stress hormone cortisol. Then zona reticularis for androgens. Right. Then this one, I want you to notice something unique about suprarenal glands. They have 3 arteries, but 1 vein. So one simple suprarenal vein. And remember I said the one from the right drains into the right renal vein. Not right now, drains into the IVC, I mean. So I was actually making a mistake earlier on when I was saying need to correct myself. The right suprarenal vein and the right testicular vein and the right ovarian vein, they drain into the IVC. Then the left ones will drain into the left renal vein. So left testicular, left suprarenal, and left ovarian, they drain into the left renal vein. Right. So 1 vein, but 3 arteries. So these are glands on top of the kidney. So they're also more likely to get blood supply from the renal artery. That's number 1. Number 2, they have an artery coming directly from the aorta, which we just call suprarenal artery. It's the middle suprarenal artery. Then they have a blood supply coming from the very first branch of the aorta when it goes into the abdomen, which we call inferior phrenic artery. So inferior phrenic artery, suprarenal from the aorta, then the renal artery. They are the three blood supplies for the suprarenal glands. Right. The same renal fascia that surrounds the kidneys will surround those suprarenal glands. But what separates the suprarenal glands from the kidney is the perirenal fat. So perirenal fat will separate the suprarenal gland from the kidneys. Right. Then yeah, that's just about that. Then clinicals, an overactive suprarenal gland, there's Cushing's syndrome, which is excess cortisol. Those people have abdominal stria, central obesity, buffalo hump, they get a moon face, they get a lot of things. So that's Cushing's syndrome. Then Addison's disease is adrenocortical insufficiency when it's not working, right? Then pheochromocytoma, this is a tumor of the adrenal gland. I think for you guys, it's just okay to know that it's a tumor of the adrenal gland, specifically in the medulla, right? And not really go to the specifics. Then for the kidneys, remember, they are part of your abdominal examination. So when you're doing an abdominal examination on a patient, you should be able to also assess for the kidneys. We do what we call balloting. You put your hand behind on their back, then you put the other hand on front. So you try to like squeeze in between your hands so you can ballot the kidneys and see if they are ballotable. It's quite easy to feel for the kidneys in people who are quite thin as compared to people who are a bit fleshy, right? Most of the clinicals for the kidney that apply to basic sciences or anatomy, we'll talk about them when we're doing the embryology, where we talk about a pelvic kidney, a horseshoe-shaped kidney, or even not ectopic, but many arteries supplying the kidney, right? I'll open it to questions. I was supposed to do kidney, ureter, and suprarenal gland. You're free to ask.